Now coming to the effects of coronavirus on the mother. So in your pregnancy, there are no extra diseases that you will catch that if you have coronavirus, that you would not otherwise. So if I talk about if I talk about excessive fluid in the amniotic fluid in the abdomen or uterus, which is called polyhydramnios, or some women have lesser liquid in around the baby or the womb, so that problem is called oligohydramnios. These kind of problems will be the same for a person with coronavirus or without coronavirus. Some women have a smaller pelvis, the build is smaller, they're shorter in height, or they're the pelvis is not wide enough for a normal delivery. These women often go in for a surgery because normal delivery is not possible, and it is only possible for the child to come out through the abdomen by a surgery. So this will remain the same. Coronavirus cannot change that, right? But there is only one study which says that the chances of prematurity, that is delivery before completion of 9 months or 37 weeks, which is the bare minimum time that the baby should be inside you for its well-being. So the child might come to life before that. So you might develop labor pain in, say, the 7th or the 8th month of pregnancy instead of the 9th month. Now there's nothing much we can do about it at a later stage, but like I said, you must visit the hospital at 12, then 20, then 32 and 36 weeks. So at that time we'll be able to assess if you're going towards prematurity or not. You may if we feel that there is a chance of that, we may give you steroid injections. Mostly 1 or 2 shots of injections are given so that the fetus develops the lungs. Okay, so the lung development is slow. By giving steroid injections, we kind of make sure that the lung development fastens up. But these injections again can only be given between 24 and 34 weeks of pregnancy. After 34 weeks of pregnancy, there is no point of giving these injections. That is why these visits, we have studied and come to a conclusion that only these 4 visits, if you have only these 4 visits, we might be able to catch all the problems at the right time and give you the right kind of intervention. Not all pregnant women need these injections, and not even all corona positive women will need this special injection of steroids for their baby's lungs, but some will. So this we can calculate. So prematurity is the only documented risk which they say is possible. It is also not 100% yet because the studies are still ongoing and we don't have a very wide database of pregnant women who have gotten infected and what was the outcome. So this is from as much data as we have, this is the only problem that we see. Otherwise, if you talk about miscarriages or early pregnancy losses, these kind of problems have not been seen with coronavirus. So even if you're infected, it does not really lead you to these kind of problems. So you should not panic, you should not worry too much about it. And it is more dangerous if you catch coronavirus towards the last trimester, which would mean after 7th month of pregnancy. That time catching coronavirus would be more dangerous than catching it in the 1st or the 2nd trimester, that is before 7 months.